Streaming audio check. 1, 2, 3.
right. Good morning, everyone. Pleasure to see you on this rainy morning. We are here for our 11th press conference. Hard to believe, 11 weeks in a row, but it has been a pretty incredible session overall, and I really appreciate the press showing up every Friday to really hear kind of the wrap up of where we've been and where we're headed for the week ahead. Before I do get into the substance, I do want to just take a quick somber moment to just talk a second about the horrific accident that we saw yesterday on 695. It was truly unbelievable, or on Wednesday, not yesterday. The 6 workers who were the names which were released, it was quite obvious that it was the worst case possible scenario. It appears that father and son who were working together on the job both lost their lives along with 4 other workers. 6 families were forever impacted, and it's something that is just a horrific moment for our state and is really a reminder of just how important it is for drivers anywhere across the state to really respect work zones. People are putting literally their lives on the line, and this is the horrific incident when people do not take the care that's required to respect the rules of the road, and particularly when there are work zones. It's a truly unimaginable tragedy for these families, and we know that the job that they were doing is vital for us to be able to get to and from work, to and from activities. And so I want to recognize those who were killed: Rolando Ruiz, 46, of Laurel; Carlos Orlando Villatoro Escobar, 43, of Frederick; Jose Armando Escobar, 52, of Frederick; Mahlon Simmons III, 31, of Union Bridge; Mahlon Simmons II, 52, of Union Bridge; and Sybil Lee DiMaggio, 46, of Glen Burnie. To all of their family and friends, our hearts and thoughts and prayers are with them in this horrific, horrific moment in time. And we are grieving alongside of you, and just can't imagine the pain that you are experiencing. And we will do whatever we can moving forward in their memory to make sure that we don't see this horrific tragedy happen again. On a different note and pivoting, which is always difficult, I do want to thank the 2 senators who are joining me here today: Senator Rosa Pepp, who's the Vice Chair of Budget and Tax, and Senator Arthur Ellis of Charles County, who is on the Finance Committee. I will let them share some of the details of important issues that they are working on. We want to take a moment to lift up some of the issues that they have been incredible leaders on for the state of Maryland. And as we get through the finish line of session, make sure that these important issues around apprenticeships and around health equity and substance abuse, addressing substance abuse, are really raised to the finish line, get through, and signed by the governor. This week in the Senate, our top priority by far was to pass the budget bill, which was House Bill 200 and House Bill 202. I want to thank the entire Budget and Taxation Committee, the chair, the vice chair, the members, and importantly, the staff of the committee and Department of Legislative Services for their thoughtful work on the FY24 operating budget. I do want to thank the Moore administration as well. It was collaborative partnership along the way throughout that allowed us to get to a place where what we saw yesterday was a unanimously passed budget in the Maryland Senate. That is a very, very important note, that it was a bipartisan, unanimous support of the 24 budget. It's a sentiment that is often too far lost in Washington. It's what we see here in Annapolis, is working together to solve big problems. No matter who the governor is, the Senate will always have the opportunity to lead with our partners in the House, and I think we saw it yesterday as we passed the budget unanimously. It is a $63 billion budget that is reflective of our chamber's values in making responsible investments for the upcoming year, and importantly, saving for future years. That's a very, very important point in this budget. A few notable mentions: we have a structural balance of $145 million, which means we are solvent this year and in the years ahead. Preserves $3 billion in cash resources, including $2.5 billion of cash in our rainy day fund. That's 10% of general fund revenues. In my 13 years, we've almost never achieved a 10% savings rate. We were always targeting 5%. This is double the savings rate that we've had. And we also have a $500 million cash balance in the general fund. One of our top priorities always, every year that we are here, is investing in public education. And this year, the Senate invested $8.78 billion for Maryland's public pre-K to 12 schools. This is absolutely essential. It is the most important social, family, economic investment that we make as a state is to fully fund our public schools and implement the blueprint with fidelity. Not only did we do that this year, in the Senate's budget, we have $800 million above the required contribution to public education. We do this because we know that we have commitments ahead, and we are putting down money today to ensure that we meet those commitments moving forward. We also put down $200 million for transportation projects that can be used for matching federal investments that may come. One in Southern Maryland with the potential of the light rail rapid transit in Southern Maryland in Prince George's County and Charles County, is also the East-West Corridor and the Red Line in the Baltimore region. I do anticipate that we'll have a budget conference committee starting early next week to work between the differences in the House and Senate to reconcile the bills. There are only 38 amendments in the Senate bill, so it means that we don't have too many changes, and it's really a testament to the partnership that we've seen along the way. The other big issues that we will have are the cannabis bill that is nearing completion, at least the Senate's version, and we plan to have it on the Senate floor early next week. We also will be working on the Maryland 529 plan, which also should move in the Senate early next week. Before I turn it over to Vice Chair Senator Rosapep, I want to thank him and, again, his work as the Vice Chair of the Budget and Taxation Committee, and importantly on his laser-like focus on the importance of workforce and improving the possibilities and options of apprenticeships here in the state of Maryland. The Senate has made scaling up and expanding apprenticeships to meet the future needs of our state's workforce a top priority. And Senator Rosapep, as many of you all know, has been a champion and at the forefront of these important issues for years. Whether it's Senate Bill 668, the teacher apprenticeships, or Senate Bill 121, which is the More Opportunities for Career-Focused Students Act of 2023, Senator Rosapep has been the tip of the spear in thinking outside of the box of how we, as a state, prepare for the workforce of the future today. With that, let me hand it over to Vice Chair Rosapep.
Thank you. Thank you very much, Mr. President. I am here today to talk about making Maryland the apprenticeship capital of America. Our economic future depends on our employers having skilled workers here and on the workers getting the skills they need to work for those employers. It's not more complicated than that. What is complicated, as the President said, is scaling the institutions that can help working people get the skills they need. The good news is we know the institution that works, apprenticeship. The train and pray model, go to school, go to school, go to school, look for a job, that we've done in recent decades has left most young people with limited work experience, limited skills, and too many with too much college debt. In contrast, apprenticeship is earn and learn, a paycheck from day one, classroom instruction, and learning on the job from experienced professionals, and a transparent path to a family-supporting wage, a career, not just a job. It's as old as medieval Europe and China. It's as American as Benjamin Franklin and George Washington, and it's as 21st century as current apprenticeships today in construction, nursing, IT, manufacturing, insurance, restaurant management, teaching, and many more occupations. In fact, every occupation is apprenticeable. If Maryland wants to keep and attract employers, to solve workforce shortages, to raise incomes of working families, we need to scale apprenticeships. We need to grow our apprenticeships from 12,000 today to 60,000 by 2030. That's mission critical to meet the blueprint for Maryland's future goal that 45% of high school graduates by 2031 will have completed the high school level of an apprenticeship. It's also mission critical to reach Governor Moore's goal of ending child poverty. Parents with high skills and high wages are not in poverty. And it makes Maryland more competitive with Virginia, Florida, Texas, and China. Building on the blueprint and our efforts in recent years, the Senate is doing many things, and the Senate President mentioned some of them, to make Maryland the apprenticeship capital of the United States. We're doing it for state workers. We have state workforce and skill shortages. We're doing it with helping students learn more about apprenticeship opportunities. And most importantly, we've passed legislation to create the Apprenticeship 2030 Commission. Sponsored by Senator Augustine, Senate Bill 104 creates a mini Kirwan Commission to create and plan and build a consensus to reach the 2030 goal of 60,000 apprentices. Some skeptics say it's too hard. I say I agree with Governor Moore. This is Maryland's moment to be bold. Senator Ellis?
Thank you, Senator Roosevelt. And thank you, Mr. President, for inviting me to be here to share two bills with you this morning, two very important healthcare bills. The first one, I'll go most technical one first, biomarker testing. So this bill authorizes Medicaid and health insurance companies to pay for biomarker testing. So what is biomarker testing? I'll say it this way, just like I said on the Senate floor. Growing up as a little child, my mom always told me that I'm very unique, I'm very special. Turned out that my mom was right. I'm sure your mom told you the same thing too, right? If you think about your fingerprint, that's unique to each and every one of you and us. Think about going through the airport, going through CLEAR, where you scan your eyes. Our eyes is technical, it's very much unique to each and every one of us. Go to cancers and all types of diseases. There are unique features that is specific to each and every one of us. What biomarker testing does is go and find that unique aspect of that particular disease, unique to the individual, and design treatment that is specific to that individual. If you think about our former president, Jimmy Carter, diagnosed quite a few years ago with brain cancer. Everyone thought it was terminal, but he has survived. I know he's in hospice, and we pray for him and his family, but at the same time, he's still with us so many years after a really terrible brain cancer diagnosis. That's due to this unique treatment available, unique diagnosis and treatment available through biomarker testing and other advances in medicine. So the key is, why should someone be rich or very influential to be able to get this type of treatment? This bill, which is Senate Bill 805, it requires Medicaid and all insurance carriers to cover biomarker testing, which will lead to more efficient, targeted treatment of diseases in so many folks. And we've modified the bill a bit to phase it in. Our health department estimated that it would cost upwards of $600 million if we just load it up this year. So this bill calls for studies and reports back to the Senate and General Assembly on how we can ramp it up. This is biomarker testing for all diseases, all treatments. But first, we'll start out with cancer treatments. And so that's the biomarker testing bill, a simpler one, but so much more impactful to our community as we speak, is testing for fentanyl. We have a tremendous amount of overdose deaths in Maryland every year. I believe a couple of years ago, a number came out, over 900 overdose deaths in Baltimore City alone, and that was unfortunately the leading edge, largest amount. But all over Maryland, every county, every city have overdose deaths. And when individuals go into the hospitals for treatment of overdose, current tests do not show fentanyl in the system. So this bill requires hospitals who have the testing equipment to take a strip, a 75-cent strip, and use it in the urine analysis, and it will automatically tells if fentanyl is in that human, that person. Why is this important? We can't solve a problem that we don't know how big it is. We believe it's really huge. Individuals using illicit drugs, they are often laced, illicit drugs, with fentanyl. And people are not aware of this fentanyl in their marijuana, cannabis, or other drugs. So it's important that we test for it, and this bill will allow testing for fentanyl, which is Senate Bill 914.
Wonderful.
Thank you, Mr. President.
Thank you. Excellent. Well, thank you both for highlighting some really, really important and critical issues that we are all working on, but these two individual leaders have been just out front on. With that, let me just hand it over for questions.
President Ferguson, Senate Bill 528 would close a loophole in Noah's Law. It's been introduced a few times. People
Is this
would.
the interlock?
This is the interlock, yeah. It would close the loophole for people who have probation without judgment rulings, not having to get that. The bill hasn't moved in the JPR committee, even though it has bipartisan support of the chair and the vice chair. Can you speak as to why that's happened?
Look, this is one that there's been a lot of education around this bill. It's obviously we want to do whatever we can to reduce drugged and drunk driving. It is essential. I think one of the questions has been around the issue of a probation before judgment not being a conviction. And so there is an open legal question that's been worked on and whether or not it makes sense for a probation before judgment to be the basis by which somebody's liberty is infringed. It's an important question on justice, and it's always a balancing act. I will say one of the things that we've talked about as an opportunity here is that one of the very few probation before judgments that can't be expunged is drunk driving. And I understand without a doubt the importance of knowing someone's record so that if we see repeat offenses that we take the appropriate steps. This is one where the only probation before judgment that is not expunged or that is unexpungible is this probation before judgment because of a DUI, DWI. I think that this is something that we're talking about in the committee, and as a Senate overall, we really believe in second chances. We believe that if you are 10, 15, 20 years after that probation before judgment and you've changed, you had an indiscretion as a younger person, that shouldn't stick with you for your entire life. And so we are looking at the opportunities of looking at both the interlock and giving opportunity for people that had a mistake prior in life and seeing if there's a way to do something together on that piece of legislation. So, it's certainly not, I wouldn't say it's dead this year, it's in active conversations.
Mr. President, you mentioned earlier the 10% rainy day fund. Statutorily, 5% is what's required. What's the Senate philosophy now on the rainy day fund? Is it essentially another seat cushion that you guys have got money socked away under? Under what circumstances would the Senate consider tapping that additional revenue?
Certainly, I'm going to hand this over to Senator Roosevelt. The one thing I would say is this is why Maryland is a AAA bond rated state. We are financially prudent and we are thoughtful. There's uncertainty in the world right now, be it Russia's invasion of Ukraine, be it the financial crisis that we've seen with SVB and other regional banks. We want to be prepared for no matter what the circumstance is that we can protect our priorities. And so with that, let me hand it over.
Yeah, thank you. 5% sounds like a lot, $2.5 billion sounds like a lot, 10% sounds like a lot, but it's not a lot if we get a recession. I've served here for a number of years, served in the House before, and I've been through recessions. When you have a recession, when you need help for people the most, and you have a big decline in revenue, we have often in the past ended up cutting support for people who need it during the recession because we didn't have the money in the bank. This is a change in philosophy, which is a very good one in my view. Saving more because we know there's going to be a downturn in the future. We don't know when it's going to come, but when it comes, it will be bigger than 10%. And so the idea that we're stocking more money away is not just good finance and good for the AAA bond rating, as important that is. It's important so when the problems come, we have resources to solve those problems without cutting services, without raising taxes.
So is 10% the new baseline? If you have to tap that, would the General Assembly's intention be to get it back up to 10%?
I'll speak for myself. I certainly would. I frankly, and the President knows this, I've been for more than 10%. So the 10% is a big move in the right direction, but this is a situation where more is better. Saving more money in good times so you have them in bad times is inherently good, and we're making a lot of progress in that direction.
Yeah, on the 10% part, I would just say one of the challenges, when we had it at 5%, there was such an unwillingness to tap into it because we didn't want to go below the 5%. I think the key is you use the rainy day fund when it's raining, and that you have a plan for refilling it back up when the times turn. And so I think putting us at 10% really allows us that if things go in a different direction, if global finances change the way that Maryland has to approach the world, we have the funds available and we can set a plan forward for paying it back over time.
Mr. President, the House corralled, and that pun is intended, $17 million from the Maryland Stadium Authority unless the required redevelopment contracts or agreements are signed within the next 7 months. I believe the Senate put it back. Is there anything other than punitive action that could be taken to push this redevelopment along? It's been years.
You know, I wish I had an easy answer for this one. Unfortunately, we don't. This is, it's a private operator that is in a regulated industry, that industry being thoroughbred racing. And so, it is a partnership that is an engagement between the state and a private actor in a entertainment industry. I'm hopeful that we can find some additional solutions here in the next 20 days before we leave session. We think that there's an opportunity to look at models like New York or related areas who have had a public-private partnership in the operations as opposed to a private actor totally in charge of the operations of daily racing. It's complicated though. And so, we think that just stripping money away for what is increasingly looking like an unlikely plan for both tracks to be able to be completed. We don't think that's the right answer. We want to be a little bit more, have more options on the table.
Mr. President, looking at the cannabis legislation, talked to a lot of people in the hemp industry who are concerned with some language in there targeting a THC percentage cap on their products. They say if that passes as written, it would essentially put them out of business. Have you had any conversations about looking and changing that language that would effectively help them continue their business?
This is a tough issue, and I think a lot of legislators are struggling with it right now. And I know on the Finance Committee, there's been lots of conversations. I'll hand it over to Senator Ellis if he wants to add anything. It's really important to note that the hemp THC is modified with chemicals, and so the Delta 8 and Delta 9, it's this loophole that exists because of federal exemption. This product was never anticipated to be on sale with no regulation. And so, it's capitalism, so people find a way to sell what people want. And so, but it can be a very dangerous substance. And so, I think that the Finance Committee is really thinking critically about whether there's an off-ramp for these individuals who have started up companies, retail establishments. At the moment, I think that the default is probably less sympathetic to ongoing operations because this was never intended to be an ongoing legal product. It was a sort of a loophole that happened because of a mismatch between federal and state legislation. Do you want to?
Yeah, sure. Sure. Thank you, Mr. President. So this was discussed yesterday in a work group, and there is a off-ramp. So Delta 8 and other products like that, those individuals can easily apply for a license through the mechanism being set up in this bill. So that'll be no problem. And those who sell, I think, the products, that tinctures, and they can continue operations. So that bill will not harm those in that level industry.
They argue, though, that the CBD products, the percentage cap would essentially shut them down and they wouldn't be able to continue those sales as well. Is there some misunderstanding here between the hemp industry itself and the lawmakers when it comes to how this language was written?
Well, no, there's no misunderstanding because we are working with advocates in the hemp industry. We're listening to them, and so we understand exactly what their concerns are. During the bill hearing, I think we had probably 25 folks from the hemp industry who came up, and they're always here in Annapolis speaking to us, and we listen to their concerns, and we will make sure that there's an off-ramp for all of them in order to be able to continue their businesses.
I think one of the important aspects of all of this cannabis legalization, and I think one of the driving factors for me individually, is public health. We were just talking about the impact of fentanyl, and we've seen, unfortunately, in unregulated marketplaces, we've seen cannabis laced with fentanyl. We see it increasingly happening. And so by bringing a legalized cannabis market, that also includes testing to make sure that what is in that cannabis is known to be just the plant. It is known chemicals. That's one of the challenges with Delta 8 and Delta 9 as well, is that it was in I don't think it was ever anticipated as a product for sale at a retail establishment for the purposes in which I think it's often being sold. And I think everyone really kind of has a general sense and understanding. It's capitalism, so people, again, will sell what people want, but I think we want to do it in the most regulated and in a way that is protecting public health first and foremost.
I just want to ask about Boost. I know that the House kept the cut. I believe the Senate is looking at putting it back in. Where do you think that stands?
So the bill that passed the Senate, the Senate's version of the budget included the leveling off of the program from prior years at $10 million and eliminated the language that would have eliminated the program or that would have wound down the program. Certainly this will be one I'm sure will be part of the the conference committee conversation. I do want to, again, put it in perspective. The difference dollar amount is $2 million on a $10 million total allocation. The Senate's budget invests $8.78 billion in Maryland's public schools and puts an additional $800 million in for future year costs. So really what we're talking about is a $2 million difference in a program that's helping a number of young people, particularly low-income young people who are really benefiting from the opportunity.
President, the state police nominee is coming up for the confirmation hearing on Monday. Any update on the status of his nomination? I mean, do you think that the committee and the Senate, there are the votes to confirm him?
You know, I don't want to prejudge. I think it's up to each individual senator. I will say the executive nominations process is working. It is intentionally built to make sure that we have the best and talented, most talented individuals leading agencies. I think there's been a lot of work put in by the superintendent to address concerns that senators have brought forward. We'll see how, I think Monday's a very, very important day for the superintendent to lay out a plan, point by point, of how he intends to really reform an agency that has been struggling of late on a number of different fronts, be it on issues around race, be it on issues of the quota system, of pullovers and stops, on promotions, on retention. And so, you know, he knows the department. I think he, in recent conversations, I've really seen a new perspective from him and being able to lay out some of a different approach that he will bring forward. But I do think that Monday's going to be very important, and we'll see how it goes.
Will you vote for him? Are you whipping votes for the governor to get him confirmed?
I want to see how Monday goes. I think Monday, again, is really an important date. You know, my presumption is to support the governor's nominees. I think that the executive deserves to pick the team that he wants unless there is something very egregious or clear that is not. And so, and that's where, you know, I think Monday will be an important thermometer.
Is that your message to members, to let the governor have the team he wants?
Yeah, I think each member is independently elected, the beauty of the Senate.
Is that a yes or a no?
It's an answer. No, I think look, I think we all work collaboratively. I think we want the governor to be successful. I think we want every governor to be successful because every governor their success is our success, our constituent success, which is at the end of the day the most important. So we believe that Maryland should have the best, and I think that our process really helps to flush that out.
During conference committee next week, are you confident that the boost funding language will stay?
I feel confident it's very important to the Senate.
I'm gonna pull a Brian, yes or no?
I feel confident. Look, again, it's, you know, I don't want to prejudge. It's an important issue for the Senate moving forward. I think that we can do both issues. We can invest significant historic amounts of money in public education and provide a small off-ramp opportunity for for a few number of kids who are really benefiting from the program.
You do one more, guys. Nobody else has got one. I have one. There's expected legislation coming related to Charlotte Hall Veterans Home.
Oh, yeah.
We wanted to get a sense of whether or not, I know that legislation has not come out of bill drafting yet. It has not been introduced, but once it gets to your desk, do you expect that the Senate will act on that fairly quickly, and do you see it passing?
Yeah, I want to appreciate and if there's anything that a member of our Veterans Caucus wants to add to it, but the administration reached out very quickly when this was. Is there something you wanted to add as well? The administration and the Secretary of Veterans Affairs jumped out immediately to give us a heads up about what the problem was at Charlotte Hall. And, you know, it is a complicated, messy situation. And I would say the single biggest driver of it is the lack of nurses. And so when we talk about apprenticeships, when we talk about different pathways to workforce, the challenge that Charlotte Hall has most significantly and severely faced is the nursing shortage. And so they don't have the staffing to be able to prepare. I think there's something around 260 beds being used in a facility that can use up to 440 beds. And so, you know, this is a really complicated, we have got to respect our veterans and make sure that they have the best possible services in that facility. How we do it, I think, you know, I have a great deal of faith in the Secretary of Veterans Affairs to lay out a plan. I think he's put an emergency team together to try and assess what the best next steps are. I know there's an RFP is going out in September overall for this facility, and so we're going to work very closely with them to determine whether or not it's legislation that's needed or if it can be done through administrative tactics.
I appreciate the background, but my question was on the bill and the fate of the bill in the next 2 weeks.
Yeah, I don't know the specifics of the bill, so I don't know specifically. What I will say is, from my perspective, I will rely heavily on the Secretary of Veterans Affairs to get a sense of whether or not legislation is required or if this is something that administratively can be handled, and we come back next year with a more robust plan.
Could I add
Yeah,
something?
please.
And it's not about Charlotte Hall, except I'm going to double down on your point about nursing shortage. is I get complaints, and I'm sure my colleagues all the time, about wait times in emergency rooms of hospitals. When you talk to the hospitals about why do we have the incredible wait times in emergency room, it's the nursing shortage. So I just want to tie that together with where we began this, is there's not a lot of attention to what we're trying to do on apprenticeship because it's not controversial. There's nobody fighting it. There's no lobbyists fighting it. People nod their heads and say it's a good idea. But this example shows why it's mission critical. We have to solve these workforce shortages for public health as well as for the economy.
Thank you, Mr. President.
Thank you all.